And Marty, take it away.
Manu, do I see
I'm,
slides?
I'm going to launch
Okay.
yes.
Well, welcome everybody. Um, it's been a while since we've come together. There's been a lot of change in the air. We've been navigating that change. Our goal today is to bring you up to date. Armando, could you go to the next slide? With just sort of the way in which we've been organizing to be more effective this year in terms of governance operations. We have new sources of funding and a matching grant opportunity we'll walk you through. We want to bring you up to date on the work that our public comment work group has been doing really on advocacy activities, and we've got some updates there. We're highly cognizant of AI. We've more than dipped our toe into the water in those issues to make sure that the patient voice is heard there. Diagnostic safety is emergent in the world and certainly for us as a huge priority, and it will be a real emphasis this year. Project Pivot is just going on steroids. I mean, it's just cooking with gas. So we're going to bring you up to date, do a really substantive update on that. And then we'd like to leave a big chunk of time for Q&A because there is so much change happening, and we'd love to have your feedback on what we present to you today. So next slide, please. In terms of our governance and operations, we started out when was it? 2021, right?
Mhm.
As a LLC. We just quickly organized. We found a fiscal sponsor. It was actually Project Patient Care, the organization I have been the CEO of. And we progressed from there to a nonprofit organization with 501(c)(3) status that we got just last week. We got our determination letter just last week. So this is big news. For those of you who are in this journey, the IRS is about a year backed up. So that was good to know. So we have a board of directors in place. Carol Hemmelgarn, who many of you know, is our chair. Um, Sue Sheridan, Armando, Nahum, Beth Daly, Ullum, and I are on the board. We also have executive leads that have been appointed by the board. It is Sue Sheridan as CEO. I'm the Director of Policy and Advocacy. Armando is our COO. So we're lean. We also have a number of staff employees, or staff contractors, I should say, full-time and part-time that we'll bring you up to speed on. And then we have a Washington office. So next slide, please. With our increased funding, which Sue is going to speak to in a moment, we were able to actually hire Leslie Tucker, who's with us today, to be our senior policy advisor and the head of our DC office. And Leslie, many of you know because she helped us organize the Hill visits for the last couple of years. She's very well known in this space. And she has with us counsel from Capital Counsel, a law firm in Chicago or in DC. John Jonas has been, again, kind of work with Leslie, working with us for a couple of years. And we haven't really been able to offer much compensation in that time. So we're very, very grateful, John, if you're with us to have that. And then Joe, I see you here. John and Joe represent different sides of the aisle personally, and so we're going to have representation with as we need it with different sides of the aisle in DC. So I'm going to take a deep breath here and just really welcome Leslie, John, and Jonas. We're already seeing their impact in our work, and we're really, really happy to have them on board. It's going to make a huge, huge difference in our ability to be more responsive than we have been. We have been operating as volunteers, looking for time and bandwidth wherever we can find it from a number of people. We're very grateful for that, but now we have some more stability, and it's really a huge, huge milestone for us. Okay, let's move on. I'm going to move through some of this pretty quickly. Leslie's going to start co-presenting with me here a little bit, as will Sue. And Sue, I think you were going to take the lead on this slide, which is our new grant and our funding opportunity.
That's right. PFBS US was fortunate to receive a grant from an anonymous donor, very dedicated to diagnostic safety. The amount was $350,000. 50,000 of that is a matching grant. That for those of you listening, we would welcome any kind of contribution to the goal of the matching grant. And then we have, additional very generous supporters. We have several foundations who are supporting us, private sector partners, and generous individuals. Additionally, we have funding from the Patient-Centered Outcomes Research Institute that we're very grateful for. That we'll talk a little bit about that. Well, we'll talk more than a little bit, but we'll be talking about Project Pivot that they are supporters. We also have had some very generous sponsors at the launch of Pivot in our World Patient Safety Day. So, these kinds of financial supports are helping us, support our staff, support our activities, and you're going to hear more about what are those activities that we're looking forward to.
Yeah.
Next.
Sue, if I could just kind of underscore some of the things you said. We have people, just regular people who are reaching into their pocket to support us. We have people who write us a check every month. We have people with family foundations, and then we have large foundations. So we're young, we're not financially rich by any means yet, but this is how you grow an organization. And Sue Armando and I were talking this morning about how proud we are. We feel like we've kind of earned the support and the confidence of many of the people who are donating, and so we couldn't be more grateful. And so I just wanted
Yeah,
to
and let me just add one more thing to that, Marty. We are also, and maybe the right word is fortunate, but we are not. A lot of champions have asked us, what is happening to PFPS with all the changes, globally and here in the United States. And fortunately, we are not dependent on government funding, which has been a blessing. And so we are really looking outside of the government for support going forward. And we think that is a strength of ours.
Yeah. Okay, so thank you is the key
Yes.
message of this slide. And Sue, you mentioned also we've had organizations and people who've been big in-kind contributors as well, and we're grateful for that support. We wouldn't be here today with our records so far without that. Armando, I think we go forward on the slides, not backward.
Yeah.
So next, please. So I wanted to just do a recap for those of you who don't know us as well as some of you do about what we've been doing with our time over the last few years. So we have a very active public comment work group. It meets weekly. It is dedicated. People have different amounts of bandwidth, and we have filed just a lot of public comments that we know have been heard. So we filed more than 90 public comments or generated them. We didn't file them ourselves, but with the help of our network for the structural measure, we supported the age-friendly hospital measure. We have been very supportive of health equity and social determinants of health because they're real. I mean, they interfere with good outcomes, but good safety outcomes. We've been very active in supporting HCAHPS work, CMS star ratings, weighting them more towards safety, work on radiation safety, and we've been highly supportive of the movement to generate more ECQMs, digital measures that don't rely on people and the burden of reporting. And then diagnostic safety research, we've been involved in a couple of different projects there. AI development, use and oversight, our volunteers, our army of volunteers have been very, very active in this space, and we produced an article on the promise of AI plus the things that we need to be watching out for. I mean, there's been not enough patient input into the development of standards. And we think it's really, really crucial that the patient voice be heard in this space as in all spaces. And then we were very, very active in the 21st Century Cares Act and the rules that came out to really make sure that people had access to their data and that there were consequences, frankly, for organizations that didn't provide us the access that we were entitled to by law. So it's a record of achievement that I think we're proud of at this point in time and want to build on going forward. Next slide.
Could I say a comment about the AI? Another new territory that we're stepping into is, yes, the oversight and the development of, but the new space that we're stepping into is patient use of AI. And that is getting a lot of attention here, both nationally and internationally. When patients are direct users of AI chatbots and that to help them in healthcare.
Thanks, Sue.
Yep.
If I had to sort of summarize to what we're doing here, and we have been very active in the advocacy space. We've been very active in the co-creation space, and AI, especially what you just mentioned, Sue. We need to be more active in that space, and know there's a lot of talent amongst our members, our organizational members, and our individual members. So we'll be calling on you more for that as we move forward, I'm sure. Beth DeLeon was the lead writer of this piece. It took 2 years, I think, to get this through the publishing threshold, but she was diligent, and I'm especially grateful for her work there. I'm an author on this, but I didn't do anywhere near the amount of work that Beth did. And Olivia did a lot of work too, Olivia Lansbury. Okay, next slide, please. Okay, here are our priorities. This may look familiar to you. It hasn't changed a lot. What we have added this year, really because it emerged organically, is we did more work on safety of clinical practices. So we came out of the box really talking about patient and family engagement as a priority because it creates urgency, transparency, and reporting because that drives safety. Accountability and oversight because that is necessary, and the patient voice on safety and clinical practices really came out of a lot of our public comment work and a lot of our research work and a lot of the interest of our volunteers who brought issues to us. So these will be our priorities, I think, going forward, and zero harm continues to be our goal. Next slide, please. We are going to have a lot of time for Q&A and discussion. So just help us. I appreciate the forbearance in getting us through sort of this framing and reporting out. These were policy priorities that we developed going into our World Patient Safety Day activities last year. This was an iterative process that kind of got to this level of simplicity. What do we ask for? We ask for the help of our leaders in seeing the harm. If you can't see the harm, if it's underreported, if it's not reported, if it's hidden, you can't fix it. To include patients and families as co-creators and as full partners in getting better outcomes and getting the best outcomes. Not paying for harm, not paying for the waste that comes from unsafe care, not paying for things that don't work, and then fixing loopholes in the law. And Leslie, I think you're going to pivot as the main presenter here. I may comment a little bit, but you're going to come off mute and take us through some of the next slides because this is now your bailiwick.
Wow, well, thanks, Marty, and hi, everyone. Really thrilled to be officially on board now. So just taking a little bit of a deeper dive into what Marty just presented, and I want to credit Beth Daly-Ullum here too for leading a lot of this work to distill us down into some concrete messages. So seeing the harm, we know that somewhere around 5% of less reportable harm events are actually reported. And as Marty said, if we can't see it, we can't understand it, and we can't fix it. So here we will be looking for ways to step up harm reporting at a variety of levels. Include me. Evidence is very clear that patients can be very discerning about when things are not going right or well. Right now, patients are not even allowed to contribute to their own root cause analysis of their own harm events. There's a mountain's worth of work that we need to be doing under this particular banner. Patients need a place to report the harm that happens to them. That is another focus area for us going forward this year. Don't pay for harm. Harm equals waste. We don't really need to say any more about that. We know that there are laws on the books that prevent payment for certain kinds of harm events. When those are not reported, they are paid for. There is a massive opportunity there. And then finally, fixing the broken PSO statute that makes it optional for organizations to report up through the reporting pipeline to the federal level where we could actually get our arms around what we're seeing and what the patterns might be. Next slide, please.
Leslie, before you go to the next slide, I'd just like to comment that, I think people might see us as anti-PSO when they see that last bullet, and we're not. In fact, Sue and I are presenting with the ECRI PSO later today. So we look for opportunities to work with PSOs, but it's also our obligation to call out that, the data that gets reported there could be used if it were shared more, and it's just hidden. We don't have access to it, and we really do think that's an issue that we need to be dialoguing with PSOs about, with HRQ about, Craig, and frankly with the people that drafted this statute, because it was meant to be a nationwide learning system, and we have concerns that it's not functioning that way. Okay, Leslie, back to you and the next slide.
So this is a wonderful piece of work that Marty led with our public commenting work group. Really try to get us distilled down with very current and appropriate messaging for this coming year. So obviously, patients for patient safety, protection of people tops the list. Reduction of waste. We are seeing more and more stabs at statistics to try to quantify what harm is actually costing the US healthcare system in real dollars. And the numbers are pretty staggering. They're in the hundreds of billions. Reduction of burden, as Marty mentioned, including through electronic deployments of quality measures, through what AI can bring us. We're sort of on the cusp of a whole bunch of new opportunities here. Many of you are playing in those same spaces. Delivering value to patients and beneficiaries. Again, very simple equation, harm equals waste. Private sector innovation, we've spoken to that already with AI. And then equipping patients with information tools and resources. This is in part the transparency agenda, public reporting, as well as the continued investment in developing tools and resources that help us both research and implement better ways of doing things. So looking at you, Craig.
Yeah. Leslie, if I could comment on this too. So this came out of a lot of discussion with our public comment work group. But when you think about the patient safety structural measure, for example, that was meant through the public reporting of the attestation statements, frankly, all the structural measures, to increase innovation or stimulate innovation and competition by showing healthcare organizations how they stack up. And it also gives patients information that we can use. So when we talk about tools and resources, we're talking about this kind of a thing, more information that we can use to be better partners in getting the best outcomes that we can get. And these are just examples of the kinds of discussion we've had about sort of mapping our priorities to the opportunities that we see this administration and this Congress championing. Okay, back to you, Leslie.
Next slide, please. Okay, so we have a multi-pronged approach to advancing our policy agenda. So there's the public commenting and reporting. There's the work that we do to try to make sure the patient voice is heard on advisory councils and technical expert panels. All of that's very important and effective, but there are pieces of our agenda that really are in the legislative bucket. And so John and Joe and I will focus a fair amount of time on continuing the work that we have engaged in over the last few years, really making sure that leadership as well as rank and file on the Hill understand our issues, understand the stakes, and begin to hear more from champions back home about this. So it's a fairly big agenda. These are and most of you know this, these are the main committees that drive the healthcare agenda on Capitol Hill. In the Senate, it's appropriations, health, education, labor, and pensions, or health. The Senate Finance Committee, and then in particular, the Health Subcommittee of the Senate Finance Committee. We have been in conversation with many of these leaders over time, and our work this year will really focus on not only sustaining those relationships, but as I mentioned, growing more of a grassroots base to reinforce the messages that we as the leadership go in with. And then on the House side, next slide, please.
Next slide, please, Armando.
House side, again, is appropriations, Ways and Means, and Energy and Commerce are the committees that oversee the statutory, the statutes that we care about and that drive all of the public health as well as the Medicare and Medicaid work. Next slide, please.
Leslie, Before we leave that one too, let me just say that, as we build individual champions around the country, we will ask you to help us carry some of these messages forward. And we've already seen the evidence of, in some of the hearings that were done with the new agency heads, conversations that we can track to meetings we had on the Hill last year. So it's for those of you that participated, I just want you to know that in many ways, we can now track the conversations that you had. Maybe not many ways, but in some ways we can track them and see that we did some educational work, some good work. Okay, Leslie, back to you. This is our last slide, and we have to kind of move quickly here because we're going long.
Okay, so our planned activities for this year, a lot of continuation here on the left side. Stu will talk more about co-development of solutions, generating public comments, as Marty mentioned earlier. That has been fantastically powerful and effective for us, with the patient safety structural measures standing out as an example of what organized work in that space can do. I mentioned our Hill visits. We'll also have more formally organized congressional briefings. We are already working on requests for meetings with the new agency leaders as they are finally actually sworn in and seated. Convenings with our allies, strengthening relationships with the private sector, including funders, and then, as I mentioned, growing our network of champions. What we'll emphasize, diagnostic safety is a beautiful door for us to walk through in opening conversations with people, because once you start talking about it, everybody recognizes themselves or a family member in that story. And frankly, we've had some good success over the past few years. There's now dedicated federal funding to this issue, and we will continue to try to grow that. I mentioned participation on TEPS and advisory councils that are driving everything from measure development to AI oversight. Again, advancing patients' ability to report their own experiences with healthcare and harm events is a very high priority for us this year. Marty has spoken about AI, and we will continue to see how creative we can be about leveraging World Patient Safety Day.
Leslie, before we transition to you, Sue, and Project Pivot, World Patient Safety Day, we are not going to do a march this year. And I say that with sadness. I know Carol Hemmelgarn joins me because we've been doing this since World Patient Safety Day began in 2021. Even during COVID, I think we maybe had 10 people marching, Carol. And Vonda, I think you might have been at every one too. But there's just too much change. For us to be planning that now, we need to be out there fundraising and doing things 2 months ago. And it's just not in the cards for us this year. So what we're going to tentatively plan for is a congressional briefing and some kind of a conference, some kind of a event around World Patient Safety Day. We're not going to let it go, but we're just not going to do a march this year. Sadly, I say, but we'll see. Okay, Sue, and we've taken a little bit more time than I hoped, but off to you and Project Pivot. And anything else you want to say about what Leslie and I just kind of walked this group through?
No, I think you did a great job teeing up for us to talk about Project Pivot, because Project Pivot does relate a lot to the key messages about protecting patients and value. And so for those of you who don't know Project Pivot, it started in September of 24. It was launched then. It is improving patient safety, diagnostic safety, and equity through patient-reported experience and outcome measures that matter to patients. And so you can see our funders here on the screen, that we are greatly appreciative to their support and their belief that by bringing together patients and other stakeholders and really looking at these patient-reported measures, both patient-reported experience measures and patient-reported outcome measures, that we can drive safer and more equitable care. Next slide. I just want to show you right now our leadership team. Dibby Upadhyay, who is going to be on our call today, unfortunately can't join us. He is taking care of an elderly mother that they're currently in the clinic where mom has an infection. So I don't think he's going to try to jump on, but I don't think he's going to be able to. But Dibby has given us a lot of very valuable insight into the perspective of healthcare systems. And we're going to talk about that a little later on, Vonda and I. And you can see the team here. We'll go to the next slide. I want to talk about Project Pivot and the outputs and how we're going to use or implement what we're creating. And so our outputs are the first output, and this is what we've been doing up to about right now, is we've been really trying to learn about what are the patient experience and outcomes that matter most to patients and family members. What do they value the most to report to government, to researchers, to healthcare organizations to drive patient safety and accuracy, diagnostic accuracy, and reduce discrimination. So this first output, just learning what matters most to patients and families to report and what do they value the most about their experience and other outcomes. That right there can drive to that can support or patient reporting and learning systems would use our outputs. There's a lot of discussion about patient-centered value-based care. Well, I should say there's a lot of discussion about value-based care. But we have to ask ourselves, value to whom? And Project Pivot is sharing what is valuable to patients and that our healthcare system and our payments and our assessments need to be based on what matters to patients. So I think a lot of what we're contributing or creating in Project Pivot can contribute to the dialogue around value-based care. That was output number one. Output number two is a list of universal patient-reported experience and outcome survey questions. Now, as we know, a lot of what we learn in healthcare is learned through surveys to patients. Patient-reported outcomes measures are used a lot in research. That's basically how do we end up. And the patient-reported experience measures is what do we experience as we're receiving care. Now, so when I use the language PRE and PRO, they're basically questions on surveys. And we've heard loud and clear from the patient community, including those of us presenting, that the measures and the questions that we've used in the past don't capture all the questions that we would like to be asked to help move our healthcare system into safer territory. So we're going to create this list of universal, meaning universal. We're bringing together patients from the cancer community, sepsis community, mothers of color, older adults, people with disabilities, and people with a variety of healthcare experience. So we want to see, are there universal questions that everybody would want to answer or see in important survey questions or surveys? Output number three is a list of population-specific PRO and PRE questions, survey questions. We're focusing and honing in on the mothers of color, people with disabilities, and older adults. That's a special focus of Project Pivot. Output number four is a list of healthcare system prioritized patient-reported experience and outcome measures that matter to to healthcare systems and hospitals and systems to help them improve safety, diagnoses, and equity. Our long-term goal is to integrate new survey questionnaire items into national, organizational, and research survey tools such as PREMS, PROMS, HCAHPS, but that patients have prioritized. So you can see all of our outputs that we're right now in the process of creating can be used by a variety of different users and audiences, such as patient-centered value-based care, reporting and learning systems, patient-centered research, measure development, healthcare systems, the quality assessments, their research, their QI, and payers who are creating performance measures and public reporting. So you can see that the more we generate from Project Pivot, we're seeing that there are more audiences to potentially use the outputs that we're creating. You can go to the next slide, please. So we actually launched in September of 24 in Washington, D.C. during World Patient Safety Day. We had over 120 people. We polled patients, we polled healthcare systems, PSOs, government officials. And Vonda and I are going to walk you through some of what we did learn from that, and then other pollings that we've been doing. But this is just a reminder that we stepped out of the gates last September with a very diverse community of the majority being from the patient and patient organization communities. and that we got a lot of great feedback. So we'll go to the next slide. So what have we done since that launch? Well, we have been on the road. We've been online. We have done online patient surveys. We have participated in both the IHI Forum and the IHI Patient Safety Congress. We participated in the PFCC Partners webinar. And we actually did a deep dive into our priority population groups and did a workshop in conjunction with the IHI Patient Safety Congress. So we've been collecting, different input at different events. And now we want to kind of share what we've learned. Now, this is very high level, and I want you to know this work is continuing. So as we continue to get more detailed information, we'll be sharing back more details to you. But we wanted to especially share for those people at IHI and our online surveys in our priority populations that we are hearing you, we are incorporating your information, and let's go to the next slide. So we want to share what we've learned so far. And we can't present everything we've learned because we have had, I forget, Vonda, how many respondents, but we've had a lot of different responses. And so we are currently looking at all this. We want to share a high level of what we're learned so far. So we can go to the next slide. Vonda, I think you're going to go through this one.
Me too. Yeah, we've had, I think, well over 300, I want to say closer to 4, maybe a little closer to 500 various inputs since September. So this information is cumulative. And I also just want to make sure that we're crediting the analyst committee of really, really good researchers who are helping take this information, put it into some sizable chunks, and also in preparation for what we anticipate in the next phase, which Sue will run through here in just a moment, which is going to be helping prioritize these. So what we've been hearing so far from patients specifically and what they want reported regarding their experiences and outcomes, specifically to patient safety, to diagnostic accuracy and timeliness, as well as discrimination and bias. These top 5 are what I'm going to focus on for today, although, as you can see, there are a number of other big categories that we're focusing on in general. The first is patients really want to make sure that we are reporting physical, emotional, psychological, and financial harm to patients and families, how it has impacted patients and families specifically. So the harm itself, but also the impact. Also, the research that's come up so far, or the inputs that have come up so far, point to wanting to express when there's been some sort of a dismissed or ignored or disregarded, disbelieved, or stigmatized any kind of disrespect. And that it coincides with ECRI's #1 reported, I think for this particular year, there's a focus on dismissal. And so we're very interested in seeing this come up to the very top of what patients want to report. Patients also want to report bias and discrimination due to race, ethnicity, gender, disability, weight, disease, age, and other factors. And they want to report timeliness and accuracy of the diagnosis, triage, and treatments, including delays from pre-authorization process. So backing all the way up to even, we see a lot of comments around the delay in even making an appointment, or the time between a diagnosis and the beginning of a treatment for that diagnosis. And then the last one I'll cover on this particular slide is patients really want to report when there's been a perception of safety and break of trustworthiness in the healthcare system. That is matched very much so, if you'll go to the next slide, with what we are also hearing from healthcare organizations, healthcare providers. What they really want to make sure that they're hearing from patients in the form of survey questions specifically related to patient safety, as well as diagnostic accuracy and delays, and reducing discrimination, They really want to know, did you experience a harm or a near miss, discrimination or delays in care or diagnosis? And if so, how did it impact you? There's a lot of input and influenced emphasis rather on describing the experience. People in the healthcare system, I think, are really getting the message that they need to ask these questions, but they're wanting to know definitions of what does, for example, feeling heard feel like for you. Did you feel your concerns were dismissed? Were you given the opportunity and enough time to discuss your concerns? Were your concerns heard, answered, or were addressed? And were you comfortable asking those questions? Was the environment safe enough for you, or the inclusive enough for you to raise these questions? Were you informed on how to escalate concerns? That coincides very much with what patients want to be asked. And then this last row, I'll just say very quickly, they want to know, did you understand your care or diagnosis? This goes with the emphasis on the patient safety, or patients for patient safety, emphasis on diagnosis. Did you feel all of your test results were appropriately discussed with you? Did the doctors explain why they were ordering the tests, and were you given a list of tests um, of the orders when you were discharged or when you went home from the office? Lastly, did you feel safe in the hospital? Did you trust the healthcare system? You'll see that paired with what we heard from patients. And were you informed on how to report harm and or discrimination? So Sue, I'll turn it back to you
Yeah,
for any
great.
overview on these two.
Thank you, Vonda. On the previous slide, on the slide that Vonda shared about what we're learning from patients, I do want to share that behind every one of those screens, Armando, maybe you can go back a slide. I want to share that behind every one of these themes are a whole sequence of other themes, sub-themes, and potential questions, survey questions. And so these are just very, very high level. You can see on the bottom line, it addresses cultural and linguistic competencies in accessibility and accommodations for special needs. I want you to know that you're going to hear our next phase. We're really going to be, the top line is really kind of what's bubbling up as the universal, that across all populations, we're hearing this top line kind of bubble up to the top. And that those are more the universal. Going forward, we're going to continue working on universal, but we're really going to try to elevate, the potential survey questions that are created by mothers of color, people with disabilities, and older adults. So we're going to be doing a deep dive into some of the more focused areas. You can go to the next slide, Armando. On this slide, I think was really important is that we've got a plethora of information from health professionals that work in healthcare systems and what they'd like to learn from patients. I think there's a real thirst to learn more than just patient-reported outcome measures and patient-reported experience measures. We got a lot of input that doesn't really relate to a experience or outcome measure, but like Vonda said, they might want to know how well did we do? And what can we do to improve? How can we help prevent what happened to you? What are the indicators of being heard? So we're seeing this like thirst from the professionals in the healthcare system to learn so much more from the patient community that I think it is a ripe opportunity for research and other projects that I think we need to consider. I think what we're learning is that there's a lot that's not known about the patient community. So those are my reflections about this. Let's go on to the next slide. I'm going to channel Divya Upadhyay, who just sent me a slide about this, but it was actually Divi, and Divi, he is a diagnostic safety expert. Divi works at, he leads the diagnostic safety program at Geisinger, and he's been very involved with us in helping us understand the perspective from the healthcare system. And he's really kind of opened our eyes to understand that some of the outputs that we're creating, some of these potential survey questions can actually help healthcare organizations achieve some of the expectations and recommendations that our government and independent organizations such as Leapfrog. So like looking at the Leapfrog Group's hospital survey and best practices, they have a lot of recommendations around diagnostic safety. One of the recommendations is that they collect information, diagnostic information from patients. And so Pivot can help organizations achieve those recommendations and best practices. The CMS's patient safety structural measure, and Marty, you might want to chime in on this, but I understand that the patient safety structural measure is alive and has survived, changes. And that, the CMS patient safety structural measure does call for patient-reported experience measures as well as reports of discrimination. And these are attestations that that leaders of healthcare systems have to agree to or say that they are actually doing this, that they're reporting patient experience and patient reports of discrimination. So again, Pivot can help healthcare organizations achieve the patient safety structural measure. Marty, was there anything you want to add to that?
Just that there was a lot of concern that the structural measure may not be included in the 2025 fiscal year quality reporting for the Medicare program, and it looks like CMS is holding on to it.
Yeah.
We'll weigh in. We'll have an opportunity to publicly comment about why it's important. Not just that one, but all the structural measures, but that one in particular.
Thank you, Marty. And then also, I believe it was HRQ and CDC created these core elements of hospital diagnostic excellence, again, with lists of recommendations. Again, there's a recommendation that, hospitals collect patient-reported experience around diagnoses. And there are other questions that our outputs can be put in surveys to help achieve other aspects of CDC's core elements of hospital diagnostic excellence. So we're just trying to show how Project Pivot is really kind of, it's covering a lot of territory in helping organizations achieve what our government and other patient safety organizations are expecting of healthcare systems. Let's go to the next page. So I just highlight quickly, Project Pivot is in the spotlight. There was a blog that IGI featured Project Pivot. ECRI featured, sorry, there's construction above me and I can't hear very well. ECRI featured PFPS US and Project Pivot in their webinar in March when they announced the top 10 patient safety list. The Healthcare Transformation Task Force, the end of, I believe it's June, is asking us to contribute to the dialogue about value-based care. Coming up quickly is a conference in Washington, D.C., Advancing Patient Safety and Healthcare Quality, Bridging Research, Policy, and Implementation. This is hosted by the Doris Duke, Johns Hopkins, and Patients for Patient Safety US. And then finally, Marty will be talking at the PQM Partnership for Quality Measure, powered by Battelle, it shows here. And this is talking to some of the CMS Quality Measure Technical Forum. And so this is, again, our opportunity to share what we're learning to help these organizations advance their missions. Next slide, please. So we do have some new structures that we want to report. Vonda shared a gratitude to our data analyst committee, and I share their pictures here that we have. You can see 4, incredibly talented researchers that have contributed their time, and I want to thank Ehsan, Bualanen, I'm not too sure if I pronounced that right, Liz Chavarria, Michelle Bleach, and Sigal Bell, who have all been helping take all this data that Vonda mentioned and distill it into learnings and themes. We have created a healthcare systems committee. We're going to get this off the ground. So for those of you healthcare systems online, if you want to join us, USUpdate from Geisinger has agreed to lead that. And we will be creating an advisory committee for the remainder of this project. Next slide. So how do you, oh, this is just the next phase. Let's start in that purple chevron where we're at the May to September, where we will be hosting virtual sessions. We'll be reaching out to many of you to participate in this. We want to conduct surveys and focus group with patients and healthcare partners. We're going to start prioritizing some of the most important potential survey questions that we want to see on these national and organizational and research survey tools. And then we will have an in-person prioritization meeting in September during World Patient Safety Day. And then October and beyond, we're going to do a final report. We want to disseminate. We want to partner with developers to create and validate some new questions or tools, and partner with our implementers to consider steps to adopt some of these questions, survey questions that we're creating. Next slide. So how do you get engaged? For the healthcare systems online, you can join our Project Pivot Healthcare. You can go to that website. You can see there on top. You can go to our website and you can just share that you want to join the Healthcare Systems Committee and actually help us develop a strategy to collect potential PRO and PRE survey questions to include in these national surveys and organizational surveys, and even custom surveys. You know, we've learned that a lot of healthcare systems are doing their own custom surveys. If you don't have the time for the healthcare systems to join the committee, you can still participate in helping collect survey questions from your organizations via focus groups or survey tools. You can provide feedback to Project Pivot on the feasibility as we start prioritizing some of these potential survey questions. We may reach out to our healthcare systems to learn about what is the feasibility of implementation. And then finally disseminate our project findings and help advocate for uptake and use our project outputs. Next slide. Now for our patients and our patient groups, I know we've had a lot of people reach out and say they're interested. Now for some patients, they don't have a lot of time, but if they'd like to join Project Pivot and participate in just taking the surveys that we're going to be asking you, taking surveys to ask us what are those questions that should be in these larger national surveys. For some of you who have more time, we're going to be making announcements shortly about some virtual meetings to help identify and prioritize potential survey questions. And this is a little confusing. We're talking about a survey, but stay with us and we'll be reaching out to many of you to join us in these virtual meetings. And then also disseminate, you know, once we create a survey asking patients and patient groups about what should these surveys look like, what questions should be on these surveys, we're going to ask many of you to disseminate some of these questions and surveys to your patient networks. And then finally, at the end of the project, disseminate the project findings and help advocate for the uptake of what we find out in this project. So I think we're going to go to the next slide. That is a very high level and quick explanation of Project Pivot and where we are. We've got another 5 months, so we're going to be collecting more, refining more, prioritizing more, and reaching out to all of you more for your input. So I think we're at the conclusion of like Marty and my presentation, Leslie's and Vonda's input, and we want to make sure that we hear from you now. I have not been following the chat. So Marty, Vonda, anybody else been following the chat so we can either address questions or just open it up for Q&A?
Yeah, several of us have been working the chat, Sue, so
Yeah.
there's been a lot of comments and questions. I think
Great.
now if people wanted to raise their hand and Armando, you would just let them in or ask them to unmute. While we're doing that, I wanted to mention 3 things. We're missing a slide. It's the slide that has upcoming events. Sue has mentioned the Johns Hopkins conference. That's an in-person conference in DC on Friday, May 16th. If people want, and Patient-reported outcomes, diagnostic excellence, and system safety are the three priority areas that we're going to be trying to figure out how do we drive research in those areas. HRQ is also doing a webinar, part of its National Action Alliance on May 13th. I'll send out to everyone here the registration link, but it again kind of underscores that the patient safety structural measure is being implemented and it starts getting scored next year. So thank you, Craig, if you're still here for doing that, you and your team. And then we have public comment opportunities, but we'll circulate those after the event. I don't see raised hands. Come on, you're not a shy group.
Yeah.
Okay, if anyone, maybe the raised hand button is hidden. Does anyone want to just come off mute and speak?
So Adam has a question.
Okay, Adam.
Yeah, I guess I'm not shy.
We know that.
Yeah, another question that I was writing in the chat before I accidentally closed my browser just had to do with, this is fantastic, but the focus is on clinical care, and the global patient safety movement is really a public health movement. I'm just wondering if you can tease out the connections that Patients for Patient Safety might be, and this goes beyond Project Pivot. Sorry, Sue, for that.
Oh, no worries. Yeah.
Not specifically about Project Pivot, but maybe Marty and Armando. There's other movements like, and there's universal healthcare, social participation that really resonate with with patient-centered care. And yet, and also we have a focus on the US. I know we're the Patients for Patient Safety US, but again, how does it link up with larger goals?
I'll dive in here, Sue, and then you can, Sue or others, you can do this. I would say, Adam, so far it's been pretty organic. So we have a network. When people in our network have brought to our attention a clinical safety issue, we have done what we can do to advance it. I mean, we started out trying to prioritize what we thought were the big issues and, build committees around it. It didn't really take off, but then people came to us and said, look, there's overdosing of radiation. Would you be willing to public comment on a solution that we've got? There is sepsis. There are these issues that, frankly, our community has experienced that they've asked us to prioritize. And we've kind of, like, just examples of what we did. We weighed in on the NQF sort of revisiting of never events, serious safety events, just to kind of prioritize things that we knew were important to the network that we have. It can become more formalized, but that's what we've done so far. So do you want to add to that?
I think you answered it, Marty.
Good.
Yeah, I think that, I think you're right, Marty. We've been listening to our patient community, and we want to truly be patient-centered and driven by what we hear from patients. And that's everything that Marty just mentioned. Another thing that we did was, Marty, I'm thinking of the medication safety, that chemotherapy agent that was actually killing up to 1,000 patients a year in the United States. And one of our patient champions came to us to help on some. It wasn't really a public comment. Oh, I guess it was a public comment. It was comments to FDA and a working group. And I think we helped help them achieve some of the goals that they wanted. So in terms of Project Pivot, that also is being really responsive to the patient community. Patients have come to us saying, Pivot, or, age caps and other survey tools are not asking us the questions we want to answer to make healthcare safer. And so that's where our energy is coming from, our patient community, and not just our patient community, but others. But our patient community is really driving, how we approach things and what we approach.
And Adam, we've tried to get on the right groups. So, for example, we've heard a lot from many members about the ED issues, the wait times, the boarding issues, and we just weighed in. I mean, Rosie did it. Several of us did it as we used our different committee assignments or TEPs to say, this is important to us. This is important to patients. And so we've got kind of a prioritization process that is organic, and then we use our voice and we try to get into the right places.
And nobody has their hands up, but there's a question from Dan Corcoran from SafeQual. Is there an effort to create survey questions to providers to answer when they recognize diagnostic error? I remember a presenter at IHI, Jerry perhaps, believed that a desktop icon-driven survey should be asked separate from the safety event reporting system.
I can speak to that just briefly. We're not really creating questions at this phase of our development, but I will tell you that that particular question has surfaced from, especially from healthcare providers.
I mean, and it's a companion piece to what Pivot is doing, really. And that, our funding, the direction from our funders is, we're really focusing on patient-centered PREs and PROs. But I see how it could be a companion piece.
Yeah.
Mhm.
And Dan, Leslie and I were just chatting about a structural measure for diagnostic safety. I mean, there are sort of domains of diagnostic safety that have been produced as guidelines or as best practices. And that's kind of where we could start. There's also, Leslie, I didn't even know this until Leslie told me, but there is already sort of an attestation approach in CMS rules about diagnostic safety in the electronic health record. So we've got a little bit of a foothold there. I see a couple of people nodding who know more about this than I do. I think, I think that's something that's really worth, I don't want to say pushing, but emphasizing as we go forward.
Yeah, Marty, I want to remind you that you and I have to jump off and join another webinar. If there's other questions, I know.
There's one quick question ending here with Michael Millinson. PROMs and PREMs can improve overall quality of care, of course, as well as its safety. How are we approaching this?
Well, Michael, you might want to clarify that a little bit because Project Pivot is all about PREMs and PROMs and improving safety. So you might
Right, but
want to.
those measures obviously are very good at improving overall quality of care in many ways when you look at outcome measures. So I know that we're about safety. Are we in some ways working with IHI or others that these can actually improve, what treatments are given, not merely the safety of the treatments or how other things are done?
Well, you know what? The goal of Project Pivot is simply to create these potential survey questions that others can use. I mean, we are assuming this will drive to safety, Michael, and that like CMS can use them in payment and public reporting. So I think, this Project Pivot is at like step one of probably a multi-phase approach. And so, the outputs of Pivot is just what we showed at the very beginning. There are lists of questions that have been identified and prioritized by patients and healthcare systems. And so at that, I have to jump off, but continue talking if you want to. Marty and I have to log on to this other. Thank you all, and look forward to working with you. Yeah.
Thank you, everyone. And we'll send out the recording. Thanks.
Thanks, Armando.
Thank you.